today we have Senator Fred Martin, new chairman of the Health and Welfare Committee. Thanks so much for joining us today. I am curious, you haven't seen this proposed legislation yet, obviously, it hasn't been introduced, but you have considered a number of other proposals and proposed rules that loosen regulations on medical professionals across the board. I'm curious how you balance safety and making it easier for people to become providers.
Very important question. Safety is our number one, has to be, and it is our number one concern. Though access, typically if you increase access, you lower the cost. Also, people need to feel that they can have access to those services. Having grown up on a Fort Hall Indian reservation, this is would be very important to me to provide services for all Idahoans, especially those on the Indian reservations. Back to your question, we need to make sure that we provide the services that the citizens of the state of Idaho need and want at the lowest possible cost.
But at some point, does the conversation about cost and making it easier for professionals eclipse the conversation about patient safety?
I'll give you an example of the pharmacist. We have been increasing the prescriptive role of the pharmacist. To me, that makes sense. The pharmacist is readily available, it's very low cost to the citizen, and within their scope of training, there's things that we can give them. So at any level, if we can look at the training or increase the training of pharmacists or PAs or any other practice and continue to give them items that's within their training, absolutely. Because again, to me, safety, but also convenience and cost.
We recently heard a shocking report from the Legislative Oversight Committee and the Office on Performance Evaluations about the Southwest Idaho Treatment Center. And at what point do we not have enough regulations?
Again, we have oversight over that in other areas of the state of Idaho. It was a very shocking and concerning report. I've already met with the new director of the Department of Health and Welfare. He is working diligently, not only right now to correct those, but to come up with a long-term solution. That facility, as you know, at one time had a large population. Over the years, those people have been moved into home settings or different, better settings for them, and cheaper for the state. So we're down to almost a hardcore situation of people that are, because of criminal activity or severe disabilities, are in that facility. The facility was never designed, I don't think, for that population. So there's, first of all, just a design problem. But there's also been, over the years, training, staffing problems that need to and will be addressed.
Another issue that came up when we were looking into the dental health aid therapy program was it doesn't matter how many providers they are if they don't accept Medicaid. A number of the dentists I talked to said that comes down to Medicaid reimbursements. Is that something that the legislature should look at, upping those reimbursements so dentists and doctors can afford to see Medicaid patients in the first place?
Absolutely. As you know, Medicaid is a state program through federal dollars. And so we need to look at the requirements that are set upon us in respects to the percent of reimbursement that we can do. And when appropriate, and I think it would be, to make sure that the providers are given the adequate compensation. If not, then the citizens don't have some place to go, especially in a rural area.
With all of the additional Idahoans who are going to be eligible for Medicaid post-expansion, are you concerned that we don't have enough providers who will be able to see these patients in the first place?
It's always been a concern. We have, from the whole system to residency to doctors. We, of course, just opened a new medical school here in Idaho, but it's going to be a few years before those are in residency and in graduating and practicing. We need to continue to work with the systems that we have for the University of Washington and other schools, University of Utah, to get chairs for Idahoans to become doctors. But we also just need to to work on the regulations so that it's more acceptable. And residency is extremely important, that we try to get those residents here in Idaho, because typically if they practice here or their residency, they stay.
You know, when it comes to Medicaid expansion, a lot of the talk has focused on potential policy proposals like adding work requirements. Is that something that you support?
I'd be very, very cautious in adding any what we call sideboards or requirements to Medicaid at this time. We have an obligation as a legislature to enact what the citizens have voted on. It is now the law of the land. I see no need at this time. It won't be implemented until January of 2020. We've got time next year to see how it's going and to look at sideboards, but I would not be supportive of the work requirement at all.
You personally won't support it, but you are in charge of the committee. Will you hear the legislation if it's passed by the House?
Again, I need to, as a chairman, to do the will of my committee. I will talk to my committee members. I think that what I'm hearing is that there'll be something other than a work requirement, an optional training program for those, and I would want to be supporting of that. The governor has indicated a springboard off Medicaid. The work requirements, to me, is not needed for two reasons. One, these are people in the gap. They're working poor. They're already technically, or they are working. Also, the voters just enacted this. If we send a message to the voters, hey, fine, you passed it, but we're going to change it, to me that's the wrong message to be sending.
You know, a training program is one thing, but paying for it is another. That's not something that would be covered by the federal match. Does that enter into the discussion at all?
Okay, if we do a work requirement, it's mostly has to be paid by the state. If we do this optional training program, most of it can be paid through federal dollars. So that's another reason to support it. But again, it's just, if it's an optional program to help these individuals to improve their lives, to get a better job, absolutely I'd be for that.
There are other discussions surrounding Medicaid expansion that I've heard, such as maybe taking a look at the tax exemptions surrounding hospitals, whether it's the property taxes on the county level or the sales tax exemption for medical equipment. Those might not necessarily go through your committee, of course, but are those something that you would consider taking a look at?
If it's going to improve the care to the citizens, yes, I would, but no, I have not heard those proposals yet.
How about long-term funding for Medicaid expansion? The Millennium Fund proposal and the offsets from other programs that was in the governor's budget request was only for the first 6 months. It starts calendar year 2020, as you said. That's only the first 6 months of the program. Are you confident that the state is set up to pay for this long term?
You're correct. Right now we're using the Millennium Fund, the offsets, to arrive at about the $20 million for the first 6 months. It's estimated approximately $40 million ongoing after that. I believe that the offsets will more than pay for that. Just the Millennium Fund alone, we're looking at $20 million that will not need to be appropriated into that program that's available. So the offsets more than will cover, I believe, the $40 million that it will eventually cost.
One of the questions I've heard regularly from viewers is whether this will get rid of the need for the catastrophic health care fund, the CAT fund. Is that a reality?
It may be, and it probably is. I would be very cautious in eliminating that program until we know that for sure. One of the first steps in the process when someone incurs a bill is to determine eligibility. It goes from the county back to the Department of Health and Welfare, that they determine if they're eligible for a program to pay the bill. By adding Medicaid expansion, we're increasing the people that will be covered. And so it's a triggering mechanism that is there in the indigent and catastrophic program. To me, that's very beneficial. So again, it will eventually reduce significantly the cost, but I'm not ready to stop that program at this time.
So I'm I'm hearing a lot of uncertainty, not just from you, but a lot of people saying this should pay for itself. We should see offsets, but there's always a margin of error. Are you confident that the state is set up for that margin of error?
That's a good question. We will know. We'll have 6 months of the program. We come back every year. We have interim committees, so we'll be able to monitor this. I strongly believe that there'll be enough offsets to pay for it, but time will tell, and that's why we come back each year.
And this discussion, of course, is happening just days before the Idaho Supreme Court will hear the legal challenge over Proposition 2 brought by members of the Idaho Freedom Foundation. What happens if that lawsuit is successful?
There's also a lawsuit that's going through the courts in Texas. I can't control the courts, nor do I want to. I will wait for that to go through the process and see what the ruling is, and then proceed accordingly.
Is this something that, because the voters asked for it overwhelmingly, you think the legislature would look at differently and would pass it in a way that would line up with the court?
Well, that's a good question.
It's hypothetical ruling.
Yeah, very hypothetical. I guess I would want to see the ruling of the court, why they determined, if they determined. Very hypothetical, but I think it's incumbent upon us as the legislature. Our first duty is to represent our districts. My district voted overwhelmingly for Medicaid expansion. I'm going to do everything I can to represent my district.
You know, there's been recent reporting that one of the concerns in community treatment centers that rely on Millennium funds to operate is that they will have trouble, if not with some of their programs, then their entire operation, because all of those monies have been proposed to pay for Medicaid expansion. Meanwhile, I'm hearing a lot of discussion in health and welfare, both of the committees, over opioid treatment. Is this something where you're possibly ignoring a solution that's already in communities, already on the table, being funded by the Millennium Fund, in favor of some of these other ideas?
When these community senators came to us originally, the Millennium Fund funded them, telling them this is startup money. They've continued to come back. Okay, and we had Millennium Fund meeting just the other day, and we voted to fund them again, give them some money. The intent always was for the community to rally around these centers and the savings in the community to be able to fund these programs. I still support that. They're not there yet. I would, look at if they came back to the Millennium Fund again. But they need to eventually get their own funding source locally or through the general fund. They should not be continuing rely upon the Millennium Fund. They initially said they would not, and I would want to hold them to that.
There's also the prescription drug database, the tracking program that has already been set up in Idaho, where physicians and pharmacists are required to register but not necessarily update with information. Is that a loophole that the legislature needs to look at tightening?
Again, the Millennium Fund has been funding that, and if there's a loophole there, I'm not aware of that, but we would look at it and make sure to cover that.
Lots of challenges facing both you and Representative Wood. Thank you so much, Senator Martin, for your time.
Thank you.